Chairman. Secretary Carson, the New York City Housing Authority needs an estimated $25 billion in capital repairs. And earlier this month, after years of investigation, NYCHA signed a consent decree with the U.S. Attorney's Office for the Southern District of New York and HUD, in part for its extensive lead and mold problems, as well as for its failing to provide sufficient heat to its residents during the winter months due to the ongoing maintenance challenges related to its boilers. In your expert medical opinion, do residents face a health risk for living in these buildings?
Yes, I was extremely concerned when I learned about the challenges, not only with the lead, but with the mold, with the elevators, particularly with some of the elderly people there, with the heating and cooling systems. Absolutely ridiculous, and that's why we entered into this with the EPA and with the Department of Justice, because quite frankly, we were outraged that that would be going on, and it was done on the basis of false reporting.
Thank you, Dr. Carson. So during your confirmation, you stated a renewed focus of lead-based paint hazard reduction. That is what you stated at your confirmation hearings. Since becoming secretary, what has HUD done to address the issue in public housing?
Well, we have significantly increased the oversight in terms of the required reporting that is done, and then doing the follow-ups on those reports. When we get evidence of anybody, particularly a child under the age of 6 with elevated blood levels, pursuing that situation to the apartment that they live in or the house that they live in, making sure that remediation is done, and also, if it happens to be a multi-family dwelling, making sure that any other apartments in that dwelling that have children.
Okay, so you're doing proper oversight.
Absolutely.
So under the new consent decree, NYCHA will be overseen by a federal monitor for 5 years in order to ensure NYCHA complies with the decreased remediation requirements and capital repairs. How were you expecting NYCHA to meet these terms and these upgrades when you requested $0 for the Public Housing Capital Fund for FY 2019? It is great that you are exercising proper oversight, but money talks. So here you are in your hearing and confirmation hearing saying that children's health in public housing is going to be a priority. Here we are facing this big crisis in NYCHA, but yet you requested $0 for the Public Housing Capital Fund for FY 2019. So my question to you is, how do you expect NYCHA to resolve this issue when you provide zero money?
Thank you for asking that question, because in fact, one of the things that has worked so well around the country for these capital backlogs is the RAD program.
Okay,
and finally,
reclaiming my time because I know that time is running out. You know that the ranking member requested the GAO to conduct an investigation, and they issued a report earlier this year where they concluded that public-private partnerships such as RAD, the effects, long-term effect and impact of RAD are not clear yet. So the GAO report said that the amount of private financing RAD is able to leverage that they claim to leverage is higher than what is actually true. That is the GAO, the arm of the Congress. That is what they concluded. So in light of that, are you going to reassess the responsibility and the role of HUD in providing capital funds to make repairs and to deal with the issue of mold and lead across the country?
Well, you know, we could have a real discussion about the GAO's finding with RAD, but I will...
Oh, you're going to question now the GAO?
But what I will say is that, you know, we are continuing to provide significant capital for NYCHA.
Zero capital, sir. You requested zero capital. You cannot have it both ways.
I'm talking about the actual
Time.
facts.